Hey guys, my name is Christian Rokel, and this is for CST 341, and this is my informative presentation. This is just a little layout of my whole presentation, so we're going to go step by step. The first thing I'm going to talk about is what my topic is. My second one is who did I interview for my informative presentation. My third bullet point is what's the purpose of this presentation? Why did I interview who I did, and what does it have to do with my topic? The fourth bullet point is how does one become a CRNA? So I know the CRNA is an abbreviation, but we'll get to that. And our fifth bullet point and final one is a solution to the problem that I believe that needs to be. All right, guys. So my topic is about CRNA. What a CRNA is, it's actually an abbreviation. It stands for Certified Registered Nurse Anesthetist. I've worked in the medical field for about 10 years. I took care of my grandmother when I was 12 years old due to the fact that she was diagnosed with dementia. So I've come to realize that the medical field is where I want to be, and I actually would love to become a CRNA when I get older. So CRNA, like I said before, stands for Certified Registered Nurse Anesthetist. What they actually do is they're almost as skilled as an anesthesiologist, but what most people don't understand is that an anesthesiologist is required to go to a lot more schooling than a CRNA is. Further down the road, we'll get to how a CRNA can become a CRNA. And so the person that I interviewed, her name is Jamie Bergman. I currently work at Moses Cone Hospital, and I work as a nurse tech, which is the same thing as a certified nursing assistant in the neurology ICU and also the trauma center. So Jamie Bergman is someone who I work very close with because she's working almost every single shift that I work with, and she's also the one who deals with a lot of the surgeries that are coming in due to traumatic. All right, guys, so I'm going to talk about my interviewee who I interviewed. Her name is Jamie Bergman, and this is just a little information based off of Jamie. Jamie Bergman has been a CRNA for over 10 years and has an extensive experience as a registered nurse. She's been a registered nurse for 15 years, and halfway through being a registered nurse, she decided to change her career to become a CRNA, and as of now, she has been a CRNA for over 15 years and has been involved in some of the most riskiest surgeries ever heard of, and also has been mentored by world-known anesthesiologists. One of the first few questions that I asked Jamie Bergman, who's a CRNA, is what are some of the pros and cons of your job as a CRNA? We all know that having any job, there's pros and cons, and we like to look at the pros because that's what keeps us motivated. So when I asked Jamie this question, she responded with a few pros and a few cons. Her pros were that she comes in contact with so many people as a CRNA. She learned different things every day, and she's able to affect every person she interacts with because they need her service as a CRNA. And lastly, she works with some of the smartest and most intelligent people in their respective fields, and she feels that each and every day when she has a conversation with a different doctor in their own respective specialties, she learns something new every day and feels that she can use it to better her knowledge of what she's doing. Some of the cons that she has for being a CRNA is that she has a lot of time, but even though she has a lot of time when she's off, she uses it studying how to further her career and providing the best care to her patients. There's long hours spent working overtime and even sometimes on holidays. And when you're working on holidays, you don't get to spend time with family. She did say lots of debt, which is pretty funny because even though a lot of CRNAs do make a lot of money, they like to look at the impact that they're making on patients and their lives and how they could fulfill their careers and hopefully provide for their families later on when they hopefully get past their surgeries. And one thing that she really said really hit home is that she misses a lot of milestones in her children's lives that sometimes she'll never be able to. Explaining what a CRNA does can be very difficult, but according to S. Writers, a CRNA can administer anesthesia during surgical, therapeutic, and diagnostic procedures. They can perform epidural, spinal, or nerve blocks, and they also can examine medical histories of patients that they're taking care of to possibly determine if there's any allergies or illnesses that can ensure that a patient is either pain-free during their surgery or even while they're in recovery. Just some other facts about some CRNAs is in the United States, there are 11,500 males and 19,500 females that are cRNAs. This is broken down to 37.1% of males make up cRNAs, while 62.9% of females make up cRNAs. When it comes to race, 84.4% of cRNAs are white, while 9.55% are Asian, and 6.05 are made up of 2 or more races. The average age of a cRNA is 45.1 years old. That's for males, and for females, it is 44.7 years old. So, the one big question that I am hoping that I can accomplish by doing this presentation is why we should care and appreciate cRNAs more than we actually do. The reason why I believe that cRNA should be appreciated more, and even anyone in the medical field, is that we've devoted our time and our life and our education to helping others. And I think the fact that these people are willing to go into huge amounts of debt to learn about our bodies that in more ways that we can even think about. They're the first source that we go to. We go to a hospital. Everyone needs medical care. We're all going to get a surgery once in our life. And these cRNAs are lowering the cost of how much a surgery can cost. One of the things that needs to be discussed is how does one become a cRNA? This is how it actually works out. An individual will go to college and they will earn their bachelor's in science of nursing. Then they are required to work at least 2 years in an ICU environment. After a nurse has been involved in an ICU environment for at least 2 years, they're allowed to apply to a nurse anesthetist program. After they have completed their nurse anesthetist degree, which usually results in a master's degree, they are required to take a CCRN examination. A CCRN is for critical care registered nurse. After they have completed their CCRN examination, they have become nurse anesthetists. In some states, you're actually required to get a doctorate degree due to the fact that you are almost on the same level as an anesthesiologist, and it requires at least 2 more years to become an anesthesiologist. Talking to Jamie Bergman, I asked her one reason, or if there was any other reason why she decided to become a cRNA. She told me about a story about a girl that she was taking care of, actually in my unit before I was hired, was about a young girl who had a brain mass. It was actually inoperable, and at one time during her stay at the hospital, she became a mute. She was unable to talk, and the brain mass had spread so much that it affected her ability to speak. So she decided to actually take time out of her day, even when she was off. She would come in and would talk to this girl, even though that she was unable to respond. The way that they would communicate is that they would use a whiteboard. As my time has spent for at least a year in the neurology ICU, I've realized that a lot of the physical therapists and occupational therapists use these boards that are either writing on a whiteboard, or there's actually a chart where a patient will hold up a window, and in the window there are different answers. And so the physical therapist or the occupational therapist will ask a question and they'll look in a certain direction, and that's how they respond. One of the most confusing yet important acronyms that any and every healthcare worker must understand. HIPAA stands for Health Insurance Portability Accountability Act. What this essentially means is that anyone who is not directly involved in billing and or medical care, whether it being a nurse tech, a pharmacist, anybody who's involved in the direct care of that patient is not allowed to discuss any part of that person or that patient's medical history and or future operations and or planning. Alright guys, so what I said in the beginning of the video is one of the biggest things that I believe needs to be changed about how the medical field works, and also especially about cRNAs. So this is my solution. I talked about how sleep was a big factor in how cRNAs go about their work. So in sometimes some of the medical shows, you'll see how doctors and or physicians have a sleeping room. That actually is true. However, these doctors and physicians are still on call. So my solution is, of course, increased pay. Even though that we talk about how money can make you happy, these people are devoting their lives to taking care of others and their needs. So even though getting a better paycheck is very nice and you can provide for your family, knowing that you're making a difference in someone's life, whether or not they remember your name, is something that they will hold true to the bone until they die. One thing, additionally, we need to discuss that these people love what they do. They learn something every single day. They better their knowledge every single day. They're not afraid to ask questions because they're putting their patient's best interest when they are assessing that patient and determining what is the best plan of care that we can get this person to back to their daily lives, back to their families. Their families want them to be whole again. They've had an injury, they've had something that is so traumatic that we need surgeries. And CRNAs play a huge role in pain management. And we know how much pain can cause someone. It will change their mood, it will change how they act, it will even change their own family. If we appreciate how much CRNAs do, even physicians and anesthesiologists, they're all on the same team. Whether or not you've been into a surgery, you're going to have a surgery eventually. These people are devoting their lives to taking care of you, and they're making sure that you get back to your family so you can provide for their family.